I was looking for a portable device that could be brought into relatively small spaces and one that would have a relatively high level of precision with a rapid turnover time that's also safe. A lot of the portable scanners that are out there, they take up a very large footprint. It's hard to maneuver them. I've had several years of experience with a lot of different good ones out there on the market, but actually getting a patient scanned was quite a bit of a process. This device, without it being a closed arm, able to mobilize around the patient and fit into relatively small places and uh, have a really tight footprint, seemed especially attractive. So we ended up
Understood.
taking it and starting in the operating room for that post-operative confirmation. And since we
Yeah.
started doing that, it's been taking a larger and larger role in our flow. Even in the time that we started using it at the beginning, it was impressive with how little time it took at that time to right now. It's just continued to get more and more efficient. You know, Historically, taking a patient down to the scanner after a case and then having it finished and bringing him back up, that would take upwards of, 25, 30 minutes, sometimes even longer than that. Now, when we're finishing up a case, my OR nurse calls the CT technologist, and then they come up and they do the scan, and we can get the whole process sometimes done in about 5 minutes. As we've optimized the process and gotten used to the technology, it's starting to have a use in all cranial surgery, essentially. So before I was starting with just tumor resections, but we've subsequently moved on to ventriculoperitoneal shunts, all of the tumor resections, both in the supratentorial and the infratentorial space or the posterior fossa. I just completed a case this morning doing a microvascular decompression, and having that scan has allowed us to accelerate our patient's care plan as part of our enhanced recovery program. The technology that's in the xCAT IQ is actually quite impressive, and it seems to be improving with the different updates, and it gives you the amount of information that you need to make that judgment call of, did we achieve what we needed to do? Is this patient safe? And in particular to what I'm doing after a tumor resection, if the case went well, I don't see any evidence of any immediate postoperative complications, it allows me to downgrade patients to suddenly not needing the ICU. Actually, the majority of my elective cases now go to the step down unit and not the ICU. And I wouldn't have the comfort to do that without the knowledge that intracranially everything looked good. And that kind of information I get through the xCAT IQ. We've used this well over 100 times now. And as the workflow has been completed, the entire staff have become more and more comfortable with it. Now we're using it in all of these cranial cases in the operating room. Our plan is to take this into the ICU next. There are a lot of patients in the neurocritical care service at our neurocritical care unit where, when there's a change in the patient's neurological exam, getting him packed up and transported down to the ICU actually has more risk than even these patients in the operating room. So once we're able to get these patients for that confirmation, one, there's no new bleeding. One, a bleed hasn't gotten worse. One, there's not another issue that we weren't expecting. That provides a tremendous amount of value. It's been so well received in the hospital. If we can show the same concept in the ICU that we did in the OR, we'll probably move it to other floors as well because it's so mobile, potentially even the emergency room, where there's an extra level of, hectic activity going on, where anytime you can decrease one step, it's going to help the patient's workflow and safety.